Thank you so much for having us today. I have fibrous dysplasia, but nobody ever really told me that. They always said that I had McCune-Albright syndrome, and that fibrous dysplasia was like the bone portion of the disease. But no one ever referred to it as fibrous dysplasia. I don't know if they did to you.
Yeah, well, it was just one of them.
But it was always, she's a McCune-Albright patient. So not really until I went to the NIH, just about a year and a half ago, almost 2 years now, did I discover that more and more people have fibrous dysplasia that may not have McCune-Albright syndrome. I'm not here to talk about that. I'm just so honored to be here. I go around the country and I speak about the journey that I've had in my life and the lessons that I've learned from it. But today, I'm not only just here as an inspirational speaker to talk about my journey, but as a friend and confidant that can understand your thoughts, pains, and happiness that you've all had, or that your children have with McCune-Albright syndrome or fibrous dysplasia. And actually, for the first time, my mother is here speaking with me. So I thought that it was really important that she come, especially since there were a lot of parents here, and that she can speak to what it's like being a parent of somebody with McCune-Albright syndrome, and that's growing older with it now, and what her feelings were like when I was diagnosed. So just to sum up my medical life over the past 38 years, God, that's old. My parents discovered at 9 months old that I got my period. I was diagnosed around 2 years old when I broke my first femur bone. I started intense physical therapy at the age of 3. Dr. Paul, you would be happy about that. At the age of 5, my physical therapist, named Carolyn, who was the woman that truly changed my life, asked me if I wanted to sit or stand or sit for the rest of my life. And I had to make the decision right then and there. She said, you're going to make a decision now, and this is going to be our path for as long as we're together. And so I decided that, hey, I was going to stand. Why would anybody sit if they could stand? And I was 5. So all my friends were, running around, and I just wanted to do the same things that they were doing. And so, like I said, it was truly my only option at that point. Had physical therapy 5 days a week for an hour a day. It was truly horrific and horrible. Even though I loved Carolyn, I actually hated doing the physical therapy because I had to do it every single day after school. That was my after-school activity. Nobody else, they would go to gymnastics or they would go to art or ballet or whatever. I had Carolyn, who was this woman that, she was terrifying, I have to say. I mean, it was truly like, and I told Dr. Conte, it was truly like training for the Olympics. It was no other way. If it hurt, sorry, you're going to work through the pain. There was no ifs, ands, or buts. So I attribute my entire life and the reason that I am and as strong as I am today is to physical therapy. And so, but then before the age of 9, I broke my femur 7 more times. Went through menopause at the age of 8. At 13, a cyst formed behind my eye that I had to get surgically removed. It was a fibrous dysplasia cyst. I was the first one in this country to ever have endoscopic sinus surgery. Every doctor from New York to Baltimore wanted to give me a craniotomy. And then we walked into Johns Hopkins, of which my mom can talk a little bit about. She said, no one is opening up my daughter's head. My mother and father and aunts who are here, they just said that that's not going to happen. I don't agree with you. There has to be a better way. And so we went to Johns Hopkins, and you might have heard of the doctor today, Dr. Ben Carson, who was in the news and possibly running for president. Who would have ever thought that? But when we walked into the room, you would have never thought that he was this genius doctor. My mom and my aunt were there, and we just thought that he was coming in to clean the room, honestly. Like, we had no idea that he was this, like, incredible surgeon, because, there was no research back then. Like, you couldn't, like, Google him to to see what he did before. Like, I honestly relied on other doctors, and they're, you know, he came in like scrubs, and we had no idea. He didn't even introduce himself. He just walked in, so we were like, okay, what is he doing here? But they decided at that point, they put a room of doctors in, and a doctor, a ENT, by the name of Dr. David Isley, who was a fellow or resident at the point, just said, you know, I know what this is, and I want to try something. And so my parents just had faith, and they tried something instead of opening up my head, because that was just a no. That was never going to happen. From my perspective, all I cared about was that they weren't going to shave my head, because it was bat mitzvah season, and I just had to go to bat mitzvahs, and that's really all I cared about. You know, you're 13 years old, you grow up with this disease, it becomes part of you. It's not, every time I talk about it, it's not, you know, everyone's like, oh, well, how was it growing up? Well, I don't know any other way. So it was great. I had a great childhood. Yes, I had medical issues along the way, but my medical issues really made me stronger. Every time that there was a challenge, I felt like it gave me more strength. And, you know, now at the age of 38, last year, I had like my first, I mean, yes, I had that sinus surgery, but I was 13. I don't really, I mean, I remember some parts of it, but I don't really remember. And I really had my first orthopedic surgery at the age of 38. They did at age 2. Well, at 2, but I don't remember that, so that doesn't really count. But at age 2, I had a shepherd's.
Well, you have a shepherd's.
I had a shepherd's, correct. See, this is why she's here, just to correct me. But anyway, at the age of 38 was really the first time, and the surgeon that was that spoke to you all yesterday, Dr. Francis Lee. I'm sorry, I was actually speaking elsewhere. I asked him to come and speak, and then of course I didn't show up, which was just rude. But I had another speaking engagement at a high school that I made a commitment for before I knew about this, so I had to do that. But it was really the first time, and I saw, you know, all the challenges that people see when they have major surgery. And it's interesting from, you know, I'm just talking about it from a patient's perspective, is that, you know, I go in, I never had any surgery before. So, you know, like real surgery that I was truly involved in. So what did I do? As a businesswoman, I set up a conference call with all the doctors that I knew. So I had Dr. Collins on the line with Dr. Lee. Dr. Collins, I was like, you have to sign off on this guy. Like, I don't really know. You know, so we came to this consensus, and we had a conference call, which I scheduled. And we all spoke about it, and I took it from a very strategic place in my life, because that's how I grew up, and that's what I know to do today. I looked at it like I was doing any project. If I'm, you know, promoting Cosmopolitan magazine, or now I have a new job and I work for Madonna, you know, like whatever it may be, I took the same way that I would execute a promotion, I executed my surgery. And so once Dr. Collins and a few other doctors signed off, we went, we had this surgery. It sucked. Oh my God. They were like, Dr. Lee was like, it's not so bad. It's not going to be so bad. You know, I'm going to put in about like 12 screws. I don't know, you should be at the hospital in what, 48 hours? Go to work maybe on Monday. That was funny because I was on a pain pump as soon as I got out of the surgery for 4 days. And then they said to me, and that, you know, truly when I talk about the strength, I had enough of the hospital. I hated being there. I didn't want to be there another second. So I said to the doctors and to the physical therapist that came in, and they said, what do you have to do? I said, what do I have to do to get out of here? They're like, you have to walk to the end of the room, or walk to the end of the hallway. Because I just had to prove that I could do it to myself. And I think that that's something that's really important with this disease, or with any disease, is that you have to prove to yourself that you can do anything you want, and that pain is truly mind over matter. Yes, it hurts. No one's going to question that it doesn't hurt. But if you have a good attitude about it, then the pain will be less severe. And so that's really what happened. And today, it took me about 4 months to heal, not because my bone didn't heal. My bone healed incredibly well, but my wound didn't heal. And my wound didn't heal because the skin, the bone was so wide that the skin was pulling. And so every time they put in stitches, the stitches would pull. So of course, it was just like this annoyance, and I had to go to a wound center twice a week. The orthopedic surgeon, Dr. Francis Lee, he was like, I'll just handle this. I'll do this. And I just knew, and my mother just knew that you're a surgeon. Like, what do you know about skin? Like, so, you know, sometimes you have to, like, listen to yourself. And I think that that's really important with anything in life, is go with what your heart and your mind tell you. And so I went to a wound specialist. I mean, that was the people that deal with wounds, not an orthopedic surgeon. And so I went twice a week for 3 months, and it finally healed. I went to a vascular surgeon, I mean, who helped me out. I mean, there was just so many people that are willing to help you, but it's, you know, you have to be, what? Finding the right ones is probably, it's like a needle in a haystack. You have to find the right people. And it's not only because the surgeon is renowned or that doctor is renowned. I think you also have to click with that doctor. And so that's really important as well. And they have to make you feel good about what they're doing to you. Remember, you're the patient. And so I think that that's really important. And then, do you want to talk a little bit about what it was like from the parents' perspective when I was diagnosed and how, you know, I always say in every speech that I give that I took over my parents' voice, and that's truly what I did. They helped me create the voice that I have today and allow me to go and speak to everybody around the world, not just as being a patient with McCune-Albright, but just being as a strong woman. And I think that's really what I'm here to talk about and here to represent.
Well, going back to when she was first diagnosed, I was a kid myself. I mean, she was born, I was only 25 years old. And by the time she was diagnosed, I was still in the 30s. So, you know, how much do you know? Which might have been a good thing, because if I knew everything then that I know now, it probably would have been terrifying. But you just sort of go one day at a time and trust some of the doctors. A lot of doctors, as you probably all know, are not that familiar with this disease. So you have to really try and find people that are. Lauren spoke about her surgery with her eye. The first surgeons that we went to actually were here in New York, very renowned, famous surgeons. And the neurosurgeon that wanted to do this craniotomy that she spoke about had told me and explained the whole thing, and I was like nervous, but I said, you know, this is what has to be done. And he said, but I'm going on vacation, so, you know, just sit tight for 3 weeks.
Meanwhile, my eye protruded a quarter of an inch out of my
head, and I said, wait a minute, what do you mean wait 3 weeks? He goes, well, I'm going away, so she'll be fine, and nothing pressing is going to happen. Well, I wasn't waiting, and friends of ours, actually, her therapist's daughter was a fellow at Johns Hopkins at the time, and I explained to her what was going on, and she said, I'm going to get you down here. So we were lucky enough to be able to get down there and see this Dr. Ben Carson, who may one day be a big politician in this country. But anyway, he was an amazing surgeon and very willing to think out of the box, put together this group, got together with these young, brilliant doctors who really cared and wanted to try and save Lauren from this whole thing. And actually, they scheduled, this was a Thursday, my sister was with us, and I wanted to go home. And he goes, are you kidding? You can't go home. You have to stay here. I said, but if the surgery is on Monday, why can't we go home for the weekend? So he said, because with what's going on in her face, she could get an infection that could kill her. I said, but the doctors in New York told me I could wait 3 weeks. So you really have to sort of know what you're dealing with, and it's kind of frightening when you're the patient and so many different doctors have different opinions, but unfortunate for us or people with this disease, it's not very well known. Like people get cancer, millions of people get cancer, so there's tons and tons of research, and as you all know, there's very little for this, but thanks to Dr. Collins, there's a lot more now. So as a parent, that's a good thing. But on a personal note, you know, Lauren's growing up, and actually me growing up with her, you know, I was very lucky to have a child like her, because she was strong and she always wanted to be like everybody else. One thing as a parent of a child with McCune-Albright or any type of disease, obviously, I think the most important thing is you can't coddle your child, you can't make them feel like poor me all the time, and, you know, put her in a chair and say, you know, just take it, you know, I'll do it for you. No, you have to make her do it for herself, and make your child be like everybody else. Because that, if you think back as a child, everybody wants to be alike, look alike, just not be different. And it's very important to make your child assimilate into school. And with schooling, I mean, at first they were thinking, oh, maybe she'll school at home, then we'll do this, we'll do that. I said, no, she's going to go to school with her friend. And then they made us have like this special bus for her and all kinds of crazy things, which she really didn't need, but, you know, we would always have like a friend that would go with her on the, like Lauren used to go, I don't want to go on the little bus, I want to go on the big bus. So, you know, there were certain things that we could do to assimilate her into the regular classroom. And when she was in the lower grades, she had an aide that was always with her because they were so afraid that she would fall. As she got older, you know, we just went to the school and insisted she just doesn't want to have the aid. She doesn't need an aid. She'll be fine.
Because the aid would make you stand out. You always had a person with you. I never wanted to stand out. I never wanted to be
Right,
different. I just wanted to be me.
So you have to fight in every situation when you have a child with a disability of any kind. And you just don't be afraid and don't let people intimidate you into not. And just make your child not afraid to be who she is. And I think that was very important. And I always stress that you can do whatever you want to do. And she did. And
Except
more.
when it came to physical therapy, she made me do it.
Well, aren't you glad today?
I am glad today. But I mean, we just keep on going back to that point. It's because I just can't stress that enough. You know, it's painful and it sucks. And like, it's really, I can't attest to the only reason that I walk today is truly because of physical therapy. When I met Dr. Collins and he looked through all my x-rays, he says, I think you're the worst case of fibrous dysplasia that I've ever seen in the history. And I was like,
but it still walks.
It still walks. And I was like, really? I was like, well, do I get like a gold badge? Like, what do I get? Like, how do I do all of this? And it's truly the only thing that I can attest it to is, so in the winter, Dr. Paul, you had everything that you said was true. We got a hot tub. My parents built a hot tub. They built a room and put a hot tub in so I could have physical therapy in the hot tub. We built a basement that my dad built all of his own equipment so I could have the most ridiculous kinds of things done to me. I would sit on a table. I would sit on this table like this, and there were 30 pounds on each leg, and everything was 30. You had to do 3 sets of 30, 3 on each leg, and I would just hang. Because when I went like this, I didn't have scoliosis when I would hang down, but when I stood up, I had scoliosis. So it was all about strengthening. And I had a treadmill. Now most people have a treadmill that you put on a button and it goes and you walk with it. No, no, no. I was like a horse. I had to make it go. Once again, 20, 30 pounds on each leg. And just stand there. You know, I was telling you the other night, I used to have to stand up against a wall, straight up against the wall for 30 minutes. I don't know, maybe that's why 3s are like my favorite numbers today, because everything was always in 3s, 30 minutes, and I would scream, and I would, but it's truly, and I cursed, like, I mean, it was just like a chocolate eyewear.
Yeah.
Yeah, she would have to leave because, I mean, obviously it's hard, you know, and painful to watch your kid go through those things, but it's truly the only thing that I can attest, you know, wearing 5-inch stilettos today. You know, I don't know anything else. I actually feel stable in stilettos. When I wear flats, my legs hurt. So I wear the taller, the bigger platform. I feel taller, I feel more comfortable, and so I'll walk, you know, 10, 20 blocks, you know, whatever it may be. But if I put on sneakers, I could like walk a block. It like bothers me. So I guess I go against science in every which way, which is fine, but that's what's worked for me for my whole life. And so I hope that you've learned some things today, you know, really for the parents that are here or for the patients that are here is just never give up, truly. And, you know, everything that is going to happen to you should make you a little bit stronger. At the point that it's happening, it'll make you feel weak, but ultimately, in the end, it'll make you stronger. So, are there any questions? Or? Yes?
Hi, Roscoe.
Hi.
You mentioned surgery cranially.
Yes.
You have cranially based fibrous dysplasia?
Yes.
Or is it poly? What's
I'm sorry, I don't understand.
Polyastotic.
Yes, polycystic.
Okay.
Good everywhere.
I would have welcomed having an assistant with me in class. When I was
With the endoscopic sinus surgery that you had at Johns Hopkins, so they didn't have to open you up, they just did it endoscopic.
They literally popped the cyst, and they saw the eye just go back in its socket.
Yeah, they actually came running out of the operating room, so excited. Before the surgery was over, and he came out and he said to me, "Her eye's back in place." He goes, "I just had to tell you." Because he was so excited, and it was funny because 10 years later, he wrote a paper about it, and he called to ask my permission to use our names and everything, which I, of course, said was fine. And, you know, we were talking a little bit, and he was asking how Lauren was, and I told him she was doing great and all this and that. And then, like, 10 years after that, no, it can't be that many years, but when anyway, it was way later, I had called him because I have another daughter, and she happened to have this big cyst on her neck, and I was, like, nervous, and I didn't know what to do about it. So I found him. He was in San Francisco at the time, and I said, "This is Holly Ruotolo," and he goes, "Oh my God, how are you and Lauren?" It's like he never forgot us, and it was like, it was very nice, and he helped us out with my other situation, but he's now back at
Johns Hopkins is actually the chief
Hopkins,
ENT.
the chief ENT.
If you ever need an ENT, go to Johns Hopkins.
Did you, and it never, the cyst never recurred?
No.
And is that
Well,
the
not
only
in that way.
surgery that you've had to have, craniofacials?
No, that was the only one.
Yeah.
And thank God, they literally, they said that they just popped it.
No, and then they had to obliterate the whole side.
Yes. But, yes.
I failed to mention a very good colleague of Dr. Carson was my neurosurgeon.
Oh, wow.
Yeah, Dr. Damaris Fawcett,
Okay.
and is professor of neurosurgery at George Washington University. And he's out of Hopkins also.
Oh, wow. Yeah, he's pretty much a good.
So how did you deal with it when you were in school when little kids would try to make fun of you?
Actually, the kids never made fun of me. Maybe because I was making fun of them. I don't know. But, no, I wasn't. But, no, I mean, I really didn't have any bullying growing up. I had adult bullying, but not from children. But because I think that I was always so interested in being like everybody else that they just saw me and they grew up with me. So by the time that we were like, you know, at the time that I guess like kids would, you know, make you feel different, like they knew me as Lauren with crutches, and that was just the way it was, and we always just did everything together. It was always the school that discriminated against me. Sometimes it was their parents that discriminated against me. Like, for instance, my mother can speak more to this, but like I wasn't invited to a roller skating party. And they didn't want to make me feel bad, so they just didn't invite me. Because they knew that I couldn't roller skate. But my mother called them and was like, well, first of all, that's rude. Second of all, like, they're best friends. How should she not go to the party? Like, she can eat, she can sing happy birthday, she can dance when they're dancing. And, you know, like, sometimes you just have to truly make people think. Because people become afraid of you. And you just can't allow that. So, fortunately, that always worked out. I think that, you know, like, if there was, like, any kind of bullying, it really didn't come until I was older and out of the school that everybody knew me from. So, like, when I went to college, people really, like, for the first time, like, I started seeing myself differently, and I think that they saw me differently as well. But, I mean, once my voice takes over, I mean, people truly forget that I'm even handicapped. I mean, so many people have told me that. And you know what I think is interesting, and anybody here that's grown up with it, or that, you know, walks with crutches or is in a wheelchair, so many people say, have never even asked me, what's wrong with you? Or, you know, what? Oh, they'll be like, oh, why does Lauren walk with crutches? And like my best friend Jason, he'll be like, what? Like, they don't even see it anymore. So I think that it's, like, once again, it's really mind over matter, and if your personality will outshine your disability.
Attitude makes all the difference in the world.
It really does. It really does, and it can, you know, it makes you strong. It can make or break you. Yeah, your fibrous dysplasia will break your bones, but you will make that better.
You just mentioned working, and I'm wondering how you handled in the workplace, just like advocating for yourself and asking for if you needed any kind of accommodation.
I never really asked for anything, ever, when it came to work. It took me, though, you know, and once again, just talking about how people discriminate you. The first time, which I talk about at length in my book, when I went to go get a job, I went on 31 job interviews before anybody would hire me, right out of college. And one or two people actually asked me if I needed special insurance. So it wasn't that they weren't hiring me because of my talent. I mean, like, I had like 6 internships under my belt, did well, like, I had like amazing experience. There should have been no reason why I was. And then when somebody asked me, like, do you need different insurance? I said, that's why they're not hiring me, because they see me as a liability. And if you think about, like, I worked for Hearst Magazines for 10 years up until a little less than 2 months ago. You know, you'd look around, and I was probably the only handicapped person in the building of 8,000. Like, they just, unfortunately, and I'm not saying it maybe because nobody applied that was handicapped, but you don't really see as many handicapped people in the workplace as I think that, or as top executives as there should be.
Yes.
Your cranial bones, what do you know where affected with the FD, with your cranial bones, anything? Or you didn't treat anything like surgeries?
No, we didn't really do anything about it at all. And as a matter of fact, no surgeon wanted to operate on me, ever. So they always said to me, until I got to you, they said, no, we don't want to operate because we don't know if we could ever stop the bleeding from your bones. And so, no, that was all we ever knew. So nobody.
That was many, many years ago.
Yeah.
But also, too, as Dr. Lindemann had said, no surgery is better surgery. So we went to a lot of doctors, and most of them in the beginning would say, oh, well, you know, when she gets a little bit older, maybe we'll do this and maybe we'll do that. But in the end, they never really wanted to do it. And, you know, she has a lot of fibrous dysplasia in her forehead and stuff, but it's never really affected anything. So.
And the only reason that I truly believe that I had this surgery on my tibia, I was in a ton of pain. And it was just constantly reoccurring, all in the same spot. And so just something had to be done. And it was just constantly swelling. And it was called an ABC cyst. I had a big cyst, an ABC cyst, which is which I guess is a cause of fibrous dysplasia.
you can get it within Fibrous Dysplasia, which is probably the same thing you have here.
So they removed that. I think that they did a little bit of bone grafting, but, huh?
Yeah, with an ABC.
Yeah, but,
Bad bone's better than no bone.
right,
Right.
but what Dr. Lee said that he was truly surprised is that when he went in and started scraping, he didn't have to scrape as much as he thought, because there was a lot more normal bone than diseased bone. So he was super surprised about it. But he's not here, so I can't. I'm not the expert in it. Is there anything else? Anyone? Yes?
Pain? Do you do anything for pain management? Are you doing?
No, not really. I mean, that was why I had the surgery because I was at pain at that moment, but on a daily basis, hardly any. I took a biophosphate for a very long time, for about 10 years before the surgery. Changed from the original Iridia, I think it was called, to the Zometa, to whatever is the newest and latest. I've had them all. But I never really went for pain management. They just wanted to fill in my bone, and at the thought at that time, this was probably when I first started it, probably 15 years ago, 16 years ago. It was really just to fill in the bone. It wasn't for pain. But I went for pain back then. I mean, when I met Dr. Collins, I was having this pain in my leg, and he gave me biophosphate at that time, but that was really it.
Lauren, do you have any endocrine issues?
Yeah, well, I got my period at 9 months, went through menopause at 8, got my period again at 13, and, lived through a hot flash probably about once a month. Constant the endocrine issues always seemed more severe than the orthopedic issues. I had very high estrogens, because your pituitary gland and your ovaries work independently of each other. But now, I've been on I'm really fine today. I've been on birth control since I'm 18, and once we found the right one, I haven't changed it, so it's 20 years now.
Thank you.